Imagine the hero of our story. Let's call him Raphael, 32 years old, in a relationship for 3 years, wanting to build complete intimacy with his partner. But there's something that leaves him frustrated. Ejaculation happens too early, before he wants it to, and he feels like he's lost control. He believes that maybe it's normal, or that it's just anxiety, and doesn't seek help. He closes himself off, avoids intimacy, feels guilt. The problem? Premature ejaculation. And premature ejaculation isn't just, it happens sometimes. When it becomes a pattern, it affects self-esteem, the couple, sexual life. In this video, you're going to discover everything nobody told you about premature ejaculation, why it happens, what the triggers are, physiological, neurological, psychological, why time alone doesn't solve it. We're going to show you the mechanism of ejaculation, how the nervous system and reflexes work. We'll cover the factors that favor premature ejaculation: sexual history, anxiety, conditioning, rapid stimuli, masturbation habits, general health, intimate relationships. We'll explain why many men avoid seeking help: shame, beliefs that it's normal, misinformation. We'll provide practical and effective solutions: control techniques like the squeeze technique and pause method, reconditioning, communication with your partner, improving healthy lifestyle routines including sleep, nutrition, exercise, habits, when to consider therapy or specialized support. We'll present a 4-week action plan for Raphael and for you. Identify the trigger, implement technique, monitor progress, adjust lifestyle. If you're in Raphael's position or recognize parts of this story, stay with me. I want you to know you're not alone. There's a path, there's a solution. And at the end, I want you to comment. What is your biggest pain regarding premature ejaculation? What prevents you from having the intimacy you desire? I want you to share, because by knowing what hurts, I can help you better. Let's begin by understanding what premature ejaculation really is and why it matters so much to men like Raphael. Premature ejaculation is one of the most common sexual dysfunctions affecting men, yet it remains one of the least discussed and most misunderstood. Studies suggest that between 20 and 30% of men experience premature ejaculation at some point in their lives, with some research indicating even higher prevalence. Despite how common it is, most men suffer in silence, feeling isolated, ashamed, and believing they're the only ones dealing with this problem. Raphael represents countless men who feel their masculinity is compromised, who avoid intimate situations out of fear of disappointing their partner, who carry a heavy burden of guilt and inadequacy. But here's what you need to understand from the beginning. Premature ejaculation is not a character flaw. It's not a sign of weakness, and it's not something you just have to live with. It's a condition with identifiable causes and effective treatments, and addressing it can dramatically improve not just your sexual life, but your overall quality of life and relationship satisfaction. So, what exactly is premature ejaculation? The clinical definition involves ejaculation that occurs within 1 minute of vaginal penetration, or before the person wishes it, along with negative personal consequences such as distress, frustration, or avoidance of sexual intimacy. However, it's important to recognize that premature ejaculation exists on a spectrum. Some men ejaculate within seconds of penetration or even before penetration occurs. Others may last several minutes, but still feel they're ejaculating earlier than they'd like and have little control over the timing. The key elements are lack of control and the distress this causes. It's not just about a specific time frame, it's about whether you feel you have voluntary control over when ejaculation happens and whether the timing is satisfying for you and your partner. There are also different types of premature ejaculation. Lifelong or primary premature ejaculation means you've experienced this issue since your first sexual experiences. Acquired or secondary premature ejaculation means it developed after a period of normal sexual function. There is also variable premature ejaculation, which is inconsistent, happening sometimes but not always, and subjective premature ejaculation, where you perceive the problem even though ejaculation time is actually normal. Now let's dive into the mechanism of ejaculation itself, because understanding how it works is crucial to understanding why premature ejaculation happens and how to address it. Ejaculation is a complex reflex involving coordination between the nervous system, brain, spinal cord, and reproductive organs. It consists of two phases, emission and expulsion. During emission, sperm moves from the testicles through the vas deferens and mixes with seminal fluid from the prostate and seminal vesicles, collecting in the urethra. During expulsion, rhythmic contractions of the pelvic floor muscles propel the semen out through the penis. This entire process is controlled by the autonomic nervous system, which operates largely outside conscious control and involves a delicate balance between sympathetic nervous system activation, which triggers ejaculation, and parasympathetic activation, which is involved in arousal and erection. There's also a neurochemical component. Serotonin, a neurotransmitter in the brain, plays a crucial role in modulating ejaculation timing. Higher serotonin levels generally delay ejaculation, while lower levels are associated with quicker ejaculation. This is why medications that increase serotonin, like certain antidepressants, can be used to treat premature ejaculation. The ejaculatory reflex also has a threshold, the point of no return, sometimes called the point of ejaculatory inevitability. Below this threshold, you can still modulate arousal and delay ejaculation. Once you cross it, ejaculation becomes involuntary and unstoppable. Men with good ejaculatory control have learned to recognize their arousal levels and keep themselves below this threshold until they're ready to ejaculate. Men with premature ejaculation often have a lower threshold, cross it quickly, or have difficulty recognizing when they're approaching it. So what causes premature ejaculation? The reality is that it's usually multifactorial, involving a combination of biological, psychological, and relational factors. Let's break down each category. From a biological perspective, several factors can contribute. Neurobiological factors include abnormal levels of neurotransmitters like serotonin, dopamine, or others in the brain regions that control ejaculation. Some men may have a genetic predisposition toward premature ejaculation. Hormonal factors can play a role. Abnormal hormone levels, including thyroid hormones or sex hormones, can affect ejaculatory control. Inflammation or infection of the prostate or urethra can cause premature ejaculation in some men. Neurological conditions that affect nerve signaling can contribute. Some research suggests that men with premature ejaculation may have increased penile sensitivity, though this remains controversial. Certain medications, particularly those affecting neurotransmitters, can trigger or worsen premature ejaculation. The psychological factors are equally important and often more prevalent. Anxiety is one of the most significant contributors, specifically performance anxiety, where you're worried about sexual performance, about satisfying your partner, about ejaculating too quickly. This anxiety creates a self-fulfilling prophecy. The more you worry about premature ejaculation, the more likely it is to happen, which increases anxiety for next time, creating a vicious cycle. General anxiety or anxiety disorders can also contribute. Depression affects neurotransmitter levels and can impact sexual function in various ways, including ejaculatory control. Stress, whether from work, relationships, finances, or other life circumstances, activates the sympathetic nervous system and can trigger earlier ejaculation. Relationship issues, including unresolved conflicts, poor communication, or lack of emotional intimacy with your partner, can manifest as sexual difficulties. Body image concerns or low self-esteem can create psychological barriers to relaxed present sexual experiences. Past traumatic sexual experiences can condition rapid ejaculation as a protective response. Then there's the conditioning factor, which is particularly important and often overlooked. Many men with premature ejaculation have inadvertently conditioned themselves to ejaculate quickly through their sexual development and habits. Think about early sexual experiences. Perhaps your first experiences involved rushed situations where you needed to finish quickly, maybe in a car, or when parents might come home, or in other circumstances where speed was necessary. Your nervous system learned that sex equals rapid ejaculation. Masturbation patterns play a huge role here. If you've consistently masturbated quickly, perhaps rushing to finish before being discovered or using pornography and rapidly advancing to climax, you've trained your ejaculatory reflex to fire quickly. Your body learns what you repeatedly teach it. The type of stimulation matters too. If you're accustomed to very intense, rapid stimulation during masturbation that differs significantly from partnered sex, your nervous system may be calibrated to a level of intensity that makes the gentler stimulation of partnered sex feel less controllable. Additionally, if you've experienced premature ejaculation repeatedly, the anticipation and anxiety can condition your body to respond with sympathetic nervous system activation as soon as sexual activity begins, triggering rapid ejaculation before you've even had a chance to enjoy the experience. Raphael's story illustrates many of these factors. When we dig into his history, we discover that his first sexual experiences were rushed and anxiety-filled. He developed a pattern of masturbating quickly, often with intense grip and rapid stimulation while watching pornography. He carries performance anxiety into each intimate encounter with his girlfriend, constantly monitoring himself, asking, "Am I going to last this time?" This vigilance prevents him from being present and relaxed, keeps his sympathetic nervous system activated, and, ironically, makes the premature ejaculation more likely. He hasn't communicated openly with his girlfriend about what he's experiencing, so she's confused and sometimes takes it personally, wondering if he's not attracted to her or if he's being selfish. This creates tension in the relationship, which adds another layer of stress. Raphael also has a stressful job, sleeps poorly, drinks more alcohol than he should, and doesn't exercise regularly, all factors that contribute to his nervous system being dysregulated and his stress response being overactive. Now let's talk about why so many men like Raphael avoid seeking help. The shame and embarrassment surrounding premature ejaculation are profound. Sexual performance is deeply tied to masculine identity in many cultures, and admitting to sexual difficulties can feel like admitting inadequacy as a man. There's often a belief that you should just be able to figure it out on your own, that needing help is weak. Many men also believe that premature ejaculation is normal, that all men experience it, or that it's just part of aging. So they resign themselves to it rather than seeking solutions. There's significant misinformation and lack of education about sexual health. Many men simply don't know that premature ejaculation is a recognized condition with effective treatments. Some fear that seeking help means there's something seriously wrong with them. Others worry about the potential treatments, perhaps fearing that medication will have side effects or that therapy will be invasive or uncomfortable. The medical system itself can be a barrier. Finding a healthcare provider who is knowledgeable and comfortable discussing sexual health can be challenging, and the prospect of having this conversation with a doctor feels mortifying to many men. But here's the truth. Healthcare providers who specialize in sexual health see premature ejaculation all the time. It's one of the most common reasons men seek sexual health care. There is absolutely no judgment. These professionals understand the physiology, psychology, and impact of premature ejaculation, and their goal is to help you find solutions. And the solutions exist. Let's talk about the practical, effective strategies for addressing premature ejaculation. These fall into several categories: behavioral techniques, psychological approaches, lifestyle modifications, communication strategies, and, when appropriate, medical interventions. Behavioral techniques are often the first line of treatment and can be remarkably effective. The squeeze technique involves stimulation until you feel close to ejaculation. Then you or your partner firmly squeezes the head of the penis, where the head joins the shaft, for several seconds until the urge to ejaculate passes, then waiting about 30 seconds before resuming stimulation. This can be repeated as many times as needed and helps you learn to recognize your arousal levels and increase your ejaculatory threshold. The stop-start or pause technique is similar but simpler. Stimulation continues until you're close to ejaculation, then all stimulation stops completely until the urge subsides, then resumes. This trains ejaculatory control without requiring the squeeze. Both techniques require practice and patience, and are most effective when practiced during masturbation first, then gradually introduced into partnered sex. Pelvic floor exercises, often called Kegel exercises, can improve ejaculatory control by strengthening the muscles involved in ejaculation. To perform them, identify the muscles you use to stop urination midstream. Those are your pelvic floor muscles. Practice contracting them for 5 seconds, then relaxing for 5 seconds, working up to sets of 10 repetitions, 3 times daily. Strong pelvic floor muscles give you more voluntary control over ejaculation. Changing sexual positions or techniques can also help. Positions where you're more relaxed and less in control of thrusting rhythm, or where penetration is less deep, may reduce stimulation intensity. Using condoms can slightly reduce sensitivity and help delay ejaculation. Focusing on your partner's pleasure first through oral sex, manual stimulation, or other activities before penetration can take pressure off your performance and allow you to be more relaxed during intercourse. The psychological approaches are crucial, especially when anxiety, stress, or relationship issues are contributing factors. Cognitive behavioral therapy, or sex therapy, can help identify and change thought patterns and behaviors that contribute to premature ejaculation. A therapist can help you work through performance anxiety, develop better awareness of your arousal, learn relaxation techniques, and address any underlying psychological issues. Mindfulness and sensate focus exercises teach you to be present in your body during sexual activity rather than stuck in your head, monitoring and worrying. Sensate focus involves a series of structured touching exercises with your partner that progressively build from non-genital touching to genital touching to intercourse, always with the focus on sensation and pleasure rather than performance or outcome. This removes pressure and helps retrain your nervous system to associate sex with relaxation rather than anxiety. Relaxation techniques like deep breathing, progressive muscle relaxation, or meditation can help manage anxiety and keep your nervous system in a more parasympathetic, relaxed state during sexual activity. Some men find it helpful to work with a therapist to process any past sexual experiences or traumas that may be contributing to premature ejaculation. Lifestyle modifications might seem less directly related to ejaculation, but they have a significant impact on your nervous system regulation, hormone levels, and overall sexual health. Regular exercise, particularly aerobic exercise, reduces stress and anxiety, improves cardiovascular health, enhances body image and confidence, and can improve sexual function overall. Aim for at least 150 minutes of moderate intensity exercise weekly. Quality sleep is essential. Sleep deprivation disrupts hormone production, increases stress hormones, impairs emotional regulation, and can worsen anxiety, all of which can contribute to premature ejaculation. Aim for 7 to 9 hours nightly and address any sleep disorders like sleep apnea. Nutrition matters. A balanced diet, rich in whole food, supports overall health, hormone production, and neurotransmitter function. Limiting alcohol is important, as while small amounts might reduce anxiety temporarily, alcohol impairs nervous system function and sexual performance and can contribute to premature ejaculation. Quitting smoking improves vascular health and nervous system function. Stress management through whatever methods work for you, therapy, meditation, yoga, hobbies, time in nature, social connection, helps regulate your nervous system. Changing masturbation habits can be transformative. Practice masturbating more slowly, with varied grip pressure and types of stimulation, without pornography or with less intense pornography, and using the stop-start or squeeze technique during masturbation to build ejaculatory control in a low-pressure context. Communication with your partner is absolutely essential and often neglected. Many men try to hide premature ejaculation from their partners, which creates distance and prevents you from working on the problem together. Have an honest conversation with your partner about what you're experiencing. Explain that premature ejaculation is a common condition you're working to address, that it has nothing to do with your attraction to them or your desire for intimacy, and that you'd like their support and patience as you work on it. Most partners are far more understanding and supportive than men fear they'll be. In fact, many partners are relieved to finally understand what's been happening and to be included in the solution rather than left confused or taking it personally. Work together to take pressure off penetration and orgasm as the definition of successful sex. Explore other forms of intimacy and pleasure. Use the behavioral techniques together, where your partner participates in the squeeze or stop-start method. Be patient with each other. Improvement takes time. Celebrate small victories along the way. Consider couples therapy or sex therapy together if relationship issues are contributing to the problem. When should you consider medical intervention? If behavioral techniques, psychological approaches, and lifestyle modifications haven't provided sufficient improvement after several months of consistent effort, or if premature ejaculation is severe, or if there seems to be a biological component, it may be time to talk to a healthcare provider about medication options. Several types of medications can help with premature ejaculation. Selective serotonin reuptake inhibitors, SSRIs, are antidepressants that have the side effect of delayed ejaculation. This side effect becomes the therapeutic effect for premature ejaculation. Medications like paroxetine, sertraline, or fluoxetine can be taken daily or on demand before sexual activity and can significantly increase ejaculation time. Topical anesthetic creams or sprays containing lidocaine or prilocaine can be applied to the penis before sex to reduce sensitivity and delay ejaculation. These need to be washed off before penetration or a condom used to avoid numbing your partner. Tramadol, a pain medication, has been used off-label for premature ejaculation with some success. PDE5 inhibitors like sildenafil, which are typically used for erectile dysfunction, are sometimes prescribed for premature ejaculation, particularly if there is also some erectile difficulty. It's important to note that medication should be prescribed and monitored by a healthcare provider, as there can be side effects and interactions with other medications. Medication is often most effective when combined with behavioral techniques and psychological approaches rather than used alone. Now let me give you a practical 4-week action plan, the same one I would give Raphael. This plan combines multiple approaches for the best results. Week 1 is assessment and foundation. Your task is to track your ejaculation, timing, and circumstances for 1 week without trying to change anything, just observe and record. Note how long from the start of sexual activity to ejaculation, what the context was, your anxiety level, your partner's response, any patterns you notice. Assess your lifestyle. How's your sleep, exercise, diet, stress level, alcohol consumption, masturbation habits? Begin daily pelvic floor exercises, 3 sets of 10 repetitions. Start a simple stress management practice, even just 5 minutes of deep breathing or meditation daily. Have an initial conversation with your partner about premature ejaculation, explaining that you're working on it and would like their support. Week 2 is implementing behavioral techniques. Begin practicing the stop-start technique during masturbation at least 3 times this week, focusing on recognizing your arousal levels and building control. Continue pelvic floor exercises daily. Implement one lifestyle change. Maybe it's improving sleep, reducing alcohol, changing masturbation habits, or starting exercise. Practice mindfulness or relaxation for 10 minutes daily. With your partner, focus on non-penetrative intimacy this week. Take penetration off the table entirely and explore other forms of pleasure. This removes performance pressure and allows you to be present and relaxed. Week 3 is progressing techniques. Continue stop-start practice during masturbation and introduce the squeeze technique as well. Continue pelvic floor exercises. When you do have partnered sexual activity, use the stop-start or squeeze technique together. Communicate openly about when you're close to ejaculation. Take breaks. Focus on your partner's pleasure. Try positions that give you more control. Continue mindfulness and lifestyle changes. Notice and celebrate any improvements even small ones. Week 4 is consolidation and evaluation. Continue all the techniques you've been practicing. Assess your progress. Is ejaculation timing improving? Is anxiety decreasing? Is your relationship with your partner improving? Is your confidence growing? Identify what's working well and what needs more focus. If you're seeing good progress, continue with the same approach. If progress is limited, consider whether you need to be more consistent with the techniques, address additional lifestyle factors, seek professional support from a therapist or healthcare provider, or explore medication options. Remember that building ejaculatory control takes time and practice. Be patient with yourself. Let's return to Raphael's story to see how this plays out in real life. When Raphael finally acknowledged his premature ejaculation and committed to addressing it, he started with the assessment week. He discovered that he typically ejaculated within 1 to 2 minutes of penetration. His anxiety was through the roof every time sexual activity began, and he'd been avoiding initiating sex to avoid the disappointment. He recognized that he masturbated quickly and intensely, slept poorly, was very stressed at work, and hadn't exercised in years. He had the difficult conversation with his girlfriend, who was incredibly supportive and relieved to finally understand what had been happening. Together, they agreed to work on it as a team. Raphael began pelvic floor exercises and a daily meditation practice. He changed his masturbation habits, taking his time and practicing the stop-start technique. He and his girlfriend spent several weeks focusing on non-penetrative intimacy, which actually brought them closer and reduced his anxiety. When they gradually reintroduced penetration, they used the stop-start technique together, took breaks, changed positions, and kept communication open. Raphael started jogging 3 times a week and prioritized better sleep. By week 8, his ejaculation timing had improved to 5 to 7 minutes. His anxiety had significantly decreased, and his confidence was growing. By 3 months, he had solid ejaculatory control most of the time, could enjoy sex without constant worry, and his relationship with his girlfriend was stronger than ever. He still occasionally uses the pause technique when needed, continues his pelvic floor exercises, and maintains his healthier lifestyle. He wishes he had addressed the problem years earlier instead of suffering in silence. Raphael's story illustrates something crucial. Premature ejaculation is highly treatable, and the earlier you address it, the better. The shame and avoidance only make the problem worse and steal years of satisfying intimacy from your life. Taking action, being consistent with techniques, communicating openly, and being patient with the process leads to real, lasting improvement. I want to emphasize that premature ejaculation, like erectile dysfunction, is not a moral failing or a reflection of your worth as a man or partner. It's a medical condition with physiological and psychological components, and it's incredibly common. You are not broken. You are not alone. And there is absolutely a path forward. The masculine ideal that says you should instinctively know how to control your ejaculation and that seeking help is shameful is not only false, but actively harmful. Sexual skills, including ejaculatory control, can be learned and improved with practice and the right techniques. What matters is your willingness to acknowledge the problem, educate yourself, try solutions, and persist even when progress is gradual. Let's also address the partner's perspective again. If you're watching this and concerned about your partner who experiences premature ejaculation, your support can make an enormous difference. Understand that this is likely causing him significant distress and shame. He's not being selfish or inconsiderate. Create a safe space for honest conversation without blame or pressure. Reassure him that you value the entire intimate experience, not just penetration, and that you're a team working on this together. Be patient with the process and celebrate small improvements. Don't make comments that could increase shame or anxiety. Participate actively in techniques like stop-start or squeeze, if he's comfortable with that. Explore ways to enhance your own pleasure that don't depend on his ejaculation timing. Consider couples therapy or sex therapy together. Your understanding and partnership can transform what feels like his problem into something you solve together, which strengthens your relationship overall. For those watching who don't currently experience premature ejaculation, there are prevention strategies worth considering. Develop healthy masturbation habits from the beginning. Take your time, vary stimulation, practice control. If you notice you're starting to ejaculate more quickly than you'd like, address it early with behavioral techniques before it becomes a pattern. Maintain open communication with sexual partners. Manage anxiety and stress effectively. Maintain a healthy lifestyle. Practice pelvic floor exercises. Stay educated about sexual health. If premature ejaculation develops, address it promptly, rather than hoping it will just go away. I also want to touch on the broader context of male sexual health and the importance of education. Many men receive virtually no education about sexual function beyond basic anatomy and reproduction. There's little discussion of normal variations in sexual response, common sexual difficulties, or how to develop sexual skills. This leaves men unprepared when problems arise and contributes to the shame and isolation they experience. We need to normalize conversations about sexual health. Create more accessible education resources. Train healthcare providers to address sexual concerns with knowledge and compassion, and dismantle the toxic aspects of masculinity that prevent men from seeking help. Sexual health is an integral part of overall health and quality of life. Problems in this area deserve the same attention and care as any other health concern. Let me share some common myths about premature ejaculation that prevent men from seeking help. Myth 1. Premature ejaculation means you're not a real man or you're sexually inadequate. This is completely false. Premature ejaculation is a medical condition affecting millions of men and has nothing to do with masculinity or worth. Myth 2. There's nothing you can do about premature ejaculation. You just have to live with it. False. There are highly effective behavioral, psychological, and medical treatments available. Myth 3. Premature ejaculation is all psychological and means something is wrong with you mentally. While psychology can play a role, there are often biological components, and either way, it's a treatable condition, not a character flaw. Myth 4. If you have premature ejaculation, your partner will leave you or be unsatisfied. Most partners care far more about emotional connection, communication, and overall intimacy than about ejaculation timing, and there are many ways to provide pleasure beyond penetration. Myth 5. Medication is the only real solution. While medication can be helpful, behavioral techniques and psychological approaches are often just as effective or more effective, especially when combined. Myth 6. Premature ejaculation means you have low testosterone or some serious medical problem. While medical issues can occasionally contribute, most premature ejaculation doesn't indicate serious disease. Myth 7. You just need to think about something non-sexual to delay ejaculation. This distraction technique is actually counterproductive. It takes you out of the moment and can increase anxiety rather than building genuine control. As we come to the end of this video, I want to leave you with encouragement and a call to action. If you recognize yourself in Raphael's story, if premature ejaculation has been stealing your confidence and intimacy, please know that change is possible. The steps we've discussed, behavioral techniques, psychological approaches, lifestyle modifications, communication, and when needed, medical support, really work when applied consistently. You don't have to suffer in silence. You don't have to let shame keep you trapped. Take the first step today, whether that's starting pelvic floor exercises, having an honest conversation with your partner, practicing new masturbation habits, or scheduling an appointment with a healthcare provider or therapist. Every journey begins with one step, and that step is always worth taking. And now, I want to hear from you. What is your biggest pain regarding premature ejaculation? What prevents you from having the intimacy you desire? Please share in the comments below. Your honesty might help someone else feel less alone and might allow me to create content that addresses your specific concerns. Let's build a community where men can discuss sexual health openly, without judgment, where we learn from each other and support each other. Remember, seeking help isn't weakness, it's strength. Working on your sexual health isn't selfish, it's an investment in yourself and your relationships. And talking about these issues isn't uncomfortable, it's necessary and courageous. Thank you for watching, and I look forward to hearing your stories and continuing this important conversation. You've got this, and you're not alone on this journey. Tentar novamente eu. Claude pode cometer erros. Confira sempre as respostas.